Chancroid is a very uncommon STD in the United States. This STD causes sores on your genital regions, and they're very open and gross. Also, glands in your groin swell, and it is extremely painful. However, it is very uncommon in the US, but there still are a few cases. Chancroid comes from a type of bacteria called Haemophilus decree. Now, it's not very common in the United States, however, it is pretty abundant in third world countries. This STD is transmitted from person to person by any form of sexual activity. Once those sores are touched, you pretty much have chancroid, and that's not good. So make sure not to touch those sores, and for nurses or anybody that deals with chancroid, wear gloves. Also, if you happen to touch the sore, make sure you wash your hands thoroughly so that you do not get the chancroid STD. Treatment for chancroid is pretty simple. Basically, you just go to the doctor, they give you a test, and if you test positive, he just puts you on antibiotics, and that pretty much clears it up in a few weeks. However, if your glands in your groin are extremely swollen, which they may be because that is a side effect and a symptom of chancroid, if the swelling doesn't go down, you need to have those drained by a medical doctor. Don't attempt it yourself. Let them take care of it, because if the swelling is still there, it'd be extremely painful. Also, chancroid does go away on its own. However, it would take well over 4 months. 4 months being the minimum time it would take you to get over it. And it would be extremely painful, very messy. It's a pus-filled disease. It's better just have it taken care of by a doctor. Once you contract the disease, chancroid, you usually have about 4 to 10 days until you start seeing symptoms and side effects that tell you that you actually have this STD. One of these symptoms would be open wounds all around your genital region, normally very filled with pus. Open wounds, not the greatest thing to look at. Also, you may have swollen glands in your groin. This would be extremely painful, and basically that tells you that you have this STD. However, if you have these side effects and symptoms, seek medical attention and they will take care of you. Chancroid is a pretty terrible STD, so you really want to stay away from that and try to prevent it. Some ways to prevent it: always the best way is abstinence from oral, anal, or vaginal sex. I mean, you don't have sex, you don't have an STD, that's just the way it goes. Also, if you are going to have sex, you should really wear either a female condom or a latex condom. Also, never ever touch a open wound. That is, you're gonna get it. So if you just do those things, abstinence if you can, and well, if you're gonna have sex, use a condom. Those will help prevent the STD, and never touch a open chancroid sore. Like I've said throughout this video, chancroid is very rare in the United States. The only people in the United States that end up getting it are people who have traveled out of the country, foreign countries, third world countries, and they bring it back and where they're treated for it. So nowadays, those are the only people in the United States that actually contract it.